Good afternoon. I am Brigitte Guerrero. I'm a student in the class of oral surgery. Today I'm presenting two final projects. In this oral surgery is a matter. Okay, get started. The security of patient is if when principal obligation to the dentistry and principal healthcare and a critical component of quality management in health services. In the field oral surgery when the invasive procedures are performed on an outpatient basis and under local anesthesia or sedation, safety cons procedures of utmost importance is very much important in your patient and sedation is very important. Historically, dental procedures were considered to carry a lower risk compared to general medical surgery. However, scientists' evidence shows in the oral cavity in the highly vasculated anatomic area colonized by microorganisms, little microorganisms, um, target for the procotylation and adaptation of regulation, such as those proposed and the World Health Organization are essential to mitigate risk and also cut adverse events. Mm, the first started in the anesthesia. Lesions in the characterized to a high volume and brief technology complex procedures, often performed on anxious patients or those with medical comorbidity comorbidities are not always diagnosed. The most common and critical risks in the dental office include anatomical complications, lesions of sensory nerves, inferior alveolar nerve or lingual nerve, perforation or maxillary sinuses, profuse hemorrhages, and bone fractures. The fundamental pillar of odontology. Um, Who for hospital operating rooms vanguard dental practice has adapted of for use in primary care clinics or dental offices. This is checklist to divided into three key surgical phases: control infections and biosecurity. The key to the center in the disease control of prevention (CDC). Another surgery procedure require a much higher level emphasis. So a routine dental consultation with other specialists in this area. An antisepsis meticulous surgical scope with antimicrobial agents of persistent action, 2% or 4%, and chlorhexidine in the area for disinfection or other procedure. The most very important sterile barriers and sterile instrument, mandatory use of surgical gown cap with high filtration mask, and sterile gloves different from common examination gloves, with a very sterilization and very clean. Sterile irrigation. Conventional dental units do not guarantee steriline water. It's not sterilization, and I can sterilization. We use sterile distilled water delivered via single-use external physical irrigation systems in the unit dental. In conclusion, bioethical committed patient safety in the oral surgery one does not depend on the speed or the individual technical brilliance of the operator, but the discipline and strict adherence to pre-established protocols and sterilized everything in my area. Future healthcare professionals adopting a culture of safety without punishment, persistent errors are analyzed that prevent them from happening again. Induced sterilization is an inescapable ethical duty. The checklist is not a psychiatric obstacle, but the most powerful tool to protect on the patient's health, avoid medical legal repercussions, and ensure the excellence of the daily clinical practice in the dentistry. Sterilization, um, business area, the mode of patient is very important. This is a must cleaning in the area. Thank you. Thanks for watching. Thanks for watching me. Thank you for your attention.